instructions with the initial invitation. Some of you may or may not have seen it, but if you could please make sure that your mics are muted so that we minimize the background noise, that would be great. If you click on, you should see a little circular icon in the middle that looks like a person with 3 lines. If you click on that, you'll see a column on the right that will indicate, you'll see your name there. So when we get to the question portion of the news conference, you can click on, there should be a little hand icon, and you can send me a symbol and we will call on you in the best order. Just be patient with us as I said, and we'll try to get to everybody. So with that, Amy Westbrook is our Public Health Division Director. She'll be speaking first and potentially only, but hopefully Chris Arisman from MDH will still be joining us. So with that, Amy, take it away.
Okay, thanks. Can everyone hear me okay? Okay, great. Thank you everybody for joining, I guess not coming, but this is the best way for all of us to connect with in mind physical distancing. So we're here to provide an update on the COVID-19 situation in St. Louis County. And unfortunately, we're seeing our numbers continue to increase, and this is a significant jump that we're having today, and a situation that is not good news. We have 11 new current confirmed cases today posted on the MDH website that we've been notified of. This includes 2 that require hospitalization. A significant percentage of these new cases are connected to St. Anne's Residence, an assisted living facility in Duluth. And we're limited to the amount of information we can tell you about this situation specifically. But this is obviously very concerning. It's a vulnerable population that St. Anne's Residence serves. And these are the situations that we've been preparing for, but hoping that they wouldn't happen. We've been working with the Minnesota Department of Health, as well as St. Anne's staff and area healthcare partners to support St. Anne's staff in infection control recommendations and implementations, supplies, and how best to respond to this surge in ill individuals, and so to support them in providing the best care for their residents. We are also in the process of working through our Emergency Operations Center to call up further assistance through the National Guard. As we talk about numbers and statistics, we always remember that these are people we're talking about. They're not just numbers. They are parents, grandparents, neighbors, and valued members of our community. And we are working to help both the residents and staff at this facility. Additionally, we need to announce that with several recent cases, we have not been able to find a link to travel or to previous confirmed cases. So that means we now believe that there is documented community transmission of COVID-19 here in St. Louis County. Something that we've always wanted to stress, that we're assuming that it has been here, and so our message has been to assume it's in every community and to act like it's in every community, but this indicates that we do have community transmission. So all of this is a reminder of the seriousness of this virus and pandemic and how quickly it can spread. It's why we continue to emphasize preventive steps, including obeying the governor's executive orders to stay at home and practice physical distancing. If you don't need to go out for groceries or other essential travel, please stay home and stay home and avoid even essential travel if you're sick. Wash hands frequently with soap and water, or use hand sanitizer, and covering coughs and sneezes with a tissue or your elbow, avoiding touching your mouth and face, and then practice good general health behaviors like getting enough sleep at night or throughout the day, include staying hydrated and eating healthy are good prevention measures as well. two things to note before the close of this is of our total 28 cases in St. Louis County, we now have 5 people hospitalized. Previous to that, we have been reporting 1 hospitalization, but there have been 2 additional hospitalizations reported today. And we've also learned that 2 earlier cases that initially did not require hospitalization now do. If there's a glimmer of hope at the end to end with this, of our total 28 cases, 11 of these individuals are now recovered and non-infectious. So as I was going to ask if Chris Erisman has joined us yet. Doesn't look like she has.
I am not seeing her on the list.
Okay. Some of the work that we're doing with the Minnesota Department of Health and this is a assisted living facilities and long-term care facilities are priority populations for all of us in the public health system. The Minnesota Department of Health does assign a case manager to every assisted living or long-term care facility that is working through an outbreak. And an outbreak includes just having one individual infected with COVID-19. And the Minnesota Department of Health assists with infection control guidelines and specific steps that the facility can take to implement prevention and control measures. So those are some of the things that the Minnesota Department of Health through the Infectious Disease Division does for any assisted living that identifies COVID-19 cases within their facility. So I guess we'll open it up for questions.
And again, if anyone wants to indicate the raised hand, I will look for those. Hopefully that's working because I'm not seeing any. So with that, I guess, does anybody want to try to unmute their mic and ask a question that way? Because I'm not seeing the little hand symbol that's supposed to, wait, I'm seeing some at the top. We'll go in alphabetical order. Andy Erickson, do you want to ask your question?
Yeah, can you hear me?
Yes.
Okay, so I'm getting the impression that you can't disclose how many of those cases are linked to St. Anne's. Is that correct?
Correct.
Okay.
Okay, Armin, you had a question?
Yes. Do you all know if everyone at St. Anne's has been tested now that cases have been discovered there?
We have been working with St. Anne's and the healthcare systems. The healthcare systems of St. Luke's and Essentia have been really supportive of St. Anne's and assisting them with testing residents who are ill and staff who are ill.
Jerry Burns, you had a question, Jerry?
Yes, I'm wondering if you can give us a sense of what it looks like for those 11 that are now recovered. Are they in another quarantine period after they're cleared? What does their life look like at the moment? Just in general.
You know, this is Amy. I can't comment on any one individual specifically. I don't even know that information, but generally speaking, the isolation period is 7 days after symptom onset or 72 hours after fever resolves without any fever relieving sort of medication. So we assume that the infectious period has ended, and because these individuals have not been hospitalized, I guess we presume that they're fine.
Ryan Genty, you had a question?
Yes, is my mic unmuted here? Let's see.
Yep.
All right. So Amy, before it was said that the peak would be coming in late April or early May. That was said in the hospital press conference last week. Obviously, with these 11 new cases here in St. Louis County, the highest jump for a single day total. Do you anticipate that this is potentially the start of that peak?
That's a good question. You know, because there's a significant percentage of these new cases associated with one facility, I don't want to try and predict what community transmission is going to look like today or tomorrow or even next week. We continue to really plan for that scenario, and the healthcare systems do as well, and our partners with the healthcare system, others, the healthcare coalition. So I wouldn't want to say that. I wouldn't want to predict anything.
Amy, this is Dana. I'm going to ask a question that was just texted to me by Briggs LaSavage. Do you have any guidance for family members at St. Anne's? Do you know, is there someone they should be calling or who they can contact?
That's a good question too. I know that St. Anne's staff is working really diligently to have good communication with families and residents associated with their facility. They have a small staff. They're working very hard, and I guess I don't want to speak for St. Anne's, but I've been in communication. We have been in communication with them regarding the importance of communication. They're very well aware of that, and they're doing everything they can to reach out to families and assuring that everybody has the current information.
All right, Katie Galliotto from the Star Tribune, you had a question?
Yeah, and this may not be one that you guys are able to answer, but I am wondering, we've been kind of following MDH's data and their lists that they're updating regularly, and St. Anne's hasn't been on their care facilities list with an outbreak. I guess I'm wondering if you might know why that is, or if there's a reason it's somehow classified differently.
Right. Right. If you do track the MDH website, Superior View Apartments is the only one listed for St. Louis County. I anticipate that St. Anne's will be listed tomorrow. It's a matter of the time frame from identification to posting. There is a 48-hour window from when MDH is identifying a facility to when they post onto the website. So we have been in touch with MDH and St. Anne's, and we have confirmed that there are cases of COVID-19 infections there. So we do anticipate that will be shown up on the MDH website tomorrow.
John, pardon me if I mispronounced your last name, Cardinal? John, are you there?
Yeah. Can you hear me now?
Yes, go ahead.
Here we go. My question is, what specific precautions are being taken inside of St. Anne's to help prevent the spread within the residents that are living there?
Well, the healthcare systems in Duluth and the Minnesota Department of Health have both offered really specific infection control guidance. They've done some walkthroughs to provide guidance. I can't say specifically what they are doing, but they are consulting with both MDH and our local healthcare systems to assure that infection control, prevention and control measures are being implemented.
See, I just noticed that Chris joined us. Chris, are you at a point or need to catch your breath that you can say a few words? Oops, I've been muted. Chris, are you there?
I'm here, but can you hear me?
Yes, we can hear you.
Okay, I am so sorry. I had to be at the governor's briefing, which ran over, and then I called in, and for whatever reason I could hear you, but you could not hear me. So I very much apologize. And it did sound like Amy had sort of gone over the roles that the state health department plays as it relates to responding to long-term care. So just let me know. Yeah, I'm sorry. I'm so sorry. But just let me know if you'd like me to go over that or what you'd like me to do.
I think that'd be great if you could say a few words.
Okay, I'm in a corner here at the State Emergency Operations Center, and I just wanted to let folks know what we're doing, what the State Health Department does when we learn about a COVID-19 case in a long-term care setting. We initiate a comprehensive investigation, including having a call with administrators and clinical staff from the facility, and then they meet with representatives from our surveillance team, from infection prevention, and from our healthcare worker exposure group. We work with them then to identify exposed residents, staff, and healthcare personnel, and then we make testing, isolation, and/or quarantine recommendations. We've developed guidance for resident contact tracing and exposure risk assessment. And so then we'll work with the facility to make those assessments. We do an extensive case interview so that we can identify any exposures within the facility as well as external to that. And then we work with the facility to talk about what measures they should take for outbreak control. So that includes isolating ill patients, cohorting if patients cannot have their own room, they would be cohorted. So ill patients would be together, non-ill patients would be quarantined to protect them. We also assess the facility's personal protective equipment, their staffing, and other resources. And so we'll work with them on those issues. We offer a virtual infection control evaluation of the facility by our infection control team. So obviously, when we're not in COVID, our teams actually go out to facilities, but in this time, they're actually doing a virtual assessment. And so they'll assess the facility, they'll identify any potential gaps, as well as provide the facility with guidance on best practices and how they can implement those. We provide communication materials for the facility, so they have letters they can use with residents, with staff, with healthcare workers, as well as talking points, so that when you contact them, they have talking points that they can use. And then we have a nurse manager that's assigned to the facility that is their sort of one-on-one person that works with them to help. And they're in touch daily, but oftentimes multiple times a day, to facilitate and expedite requests for personal protective equipment and address any questions or concerns that might come up. So those are some of the things that our team does at the MDH side. And certainly, as we've been working with facilities, we recognize that these are challenging times for them. And so we're doing what we can to provide support.
Thanks for adding that. I'm seeing more hand raises, and I'm not sure if some of them are still from before, so I'll just go down the list again. Andy Erickson, did you want to ask another question?
Yeah, Chris, I noticed some people are a little confused why there is that 48-hour notice that you have to give before it's posted to MDH. I was wondering if you could just kind of explain why that is for us.
We do that so that the facility has time to notify residents, staff, and healthcare workers so that they hear it from the facility first and not from you guys. So that's why we do that. Hello.
I guess I'll go. So, do you also have any other specific precautions for the staff that aren't infected? Are they taking extra, quarantine measures themselves within their own home?
Oh, you mean for staff that work at the facility that are not infected? So we have a team, our healthcare guidance team, and so they will work with the facility to identify both staff who may be ill and symptomatic, as well as staff who may have been exposed. as well as staff who have not been exposed and are not symptomatic. And so they will provide recommendations. So if someone has been exposed, then we'll provide them with guidance on quarantine. If someone is symptomatic, we provide guidance on the time they need to be isolated. And then if you've got somebody who is not symptomatic and has not been exposed, then we're all in the same boat for that, meaning that we all need to be watching for symptoms and isolating ourselves at the first sign.
Jerry Burns, did you have another question, or is this hand still up from the last time?
Still from the last time.
Okay. Moving down, same question. John Cardinal, did you have another question, or is it still from the last time?
It's still from the last time.
Okay. Ryan Genty, any questions from you, or is that still from the last time?
Yeah, no, I did have an additional one.
Okay,
is Amy still? Oh, yeah, Amy is still on there. Amy, this is probably just best fit for you since it's versus Chris, since it's in our area here. But just wondering, is this concerning? I know you guys said you're preparing for the community transmission, but is it a concerning development, if you will?
Yeah, I think it's a concerning development. This is a really vulnerable population. We're seeing more individuals infected who are aging and older. And we know that they're at higher risk of complications with COVID-19, a higher rate of hospitalizations. So yeah, we are really wanting to support St. Anne's as much as possible in this, and as well working with our hospitals and long-term care facilities and assisted living facilities to put strategies into place of how we can respond to these sorts of situations in the future. This is happening right now in St. Anne's and in Duluth, so we're supporting them as best we can with their immediate needs. But we recognize that this could happen anywhere in St. Louis County or the region.
Could I add something to that too? This is Chris Ersman. I just want to say that, we've really encouraged people to not focus on absolute numbers, that we recognize that we are seeing that there's much more COVID-19 activity than what is seen with the absolute numbers. So it's important that we're counting cases and we're doing the follow-up, but we also want the public to know that there's more activity out there than what our case counts will show. So we recognize that St. Louis County has seen a recent increase in cases, but we want people to know that those cases are really the tip of the iceberg.
And just to follow up too, this doesn't mean that St. Anne's was, didn't do something that they were supposed to do. It's something that they're having to work through now, but we're working to prevent these sorts of things as well with other, with the healthcare systems and other facilities.
Another question that was sent to me from Briggs of Savage saying that there's been stories circulating, not necessarily locally, of families wondering if they should pull loved ones out of long-term facilities with confirmed cases. Either Amy or Chris, do you have guidance? What would you say to families in that situation?
We've obviously been hearing about this from a lot of different locations because we've been seeing, reports in long-term care from across the state. And what we've said is obviously this is a personal decision for families, but it's very important that they consider whether or not they can provide the level of service that their family member receives in the facility that they're at. So that's an important consideration.
Thank you. Andy Erickson, did you have another question, or is your hand still up from before?
I think it's still up from before.
Okay. I think those are all the hand symbols I'm seeing. If anybody else had questions and we're just having trouble with that, if you want to just unmute your mic to ask a question, you're welcome to do so now.
I just have one last one for Amy. So I talked to Duluth Police last week, yesterday, and they had said that anyone who notices larger gatherings of people should not notify the police, but notify the state. Now that there's confirmed community spread, is there going to be any extra enforcement of social distancing in places like grocery stores and liquor stores?
Armand, you're breaking up a little bit. The gist of the question is there going to be enforcement of social distancing?
Yeah, I guess extra enforcement, I guess at a local level rather than reporting to the state.
Yeah, I'm not in public safety, so I wouldn't be able to address that. Sorry.
No.
Well, I know that the governor has said that the intent is not to cite people, but to use opportunities of clumping and not social distancing as an opportunity to educate folks.
Any final questions before we wrap up?
Yeah, if I can go again. Where do we stand with the number of, I guess, Amy, if you're able to talk about this, the ICU beds that are available right now?
That I don't know. We don't have anyone on from one of our healthcare systems in St. Louis County. That would be a better question for them.
Anyone else? Well, I think then that looks like we can wrap up. Thank you all for joining us. This was our first attempt at a news conference in this way, so thank you for your patience with us. Feel free to send me emails later of what we can do better next time or how you thought it went. But thank you all for your time this afternoon and for the good work you continue to do to get information out to the public for us. Thank you all.